In recent times, mental health issues have been at the front burner among governments and non governmental organizations. This is why the Leprosy Mission Nigeria launched a new mental health project tagged Farin Chiki, which means inner well being, joy, and happiness. The project, which is in collaboration with the Nigerian Federal Ministry of Health, had in attendance major stakeholders to advance for the well-being of all Nigerians, especially those affected with leprosy and other neglected tropical diseases. Counselor and mental health team lead, the Leprosy Mission Nigeria, Christine Bestman said the new approach to issues of mental health is the use of grandmothers as they are able to adopt mental health concepts in their culture and pass the message to the rural communities.
So the Fairy Chiki project is a project that's been set out to address the mental health needs and challenges of the rural communities in Nigeria. So the novel use of grandmothers in this context to address mental health challenges in the communities was actually from a study that was conducted in Zimbabwe, where they were found to provide that tertiary support that was needed within the communities and provide basic mental health first aid to community members. We found that these grandmothers were able to adapt mental health concept into culturally relevant subjects for the community people, as well as being members of the community. They had kind of gone through some of the adversities and faced some of the challenges that the community posed, and they were in the best position to provide support and
National Coordinator, National Mental Health Program, Federal Ministry of Health, Dr. Ojo Tunde said the collaboration is geared towards achieving universal health coverage in Nigeria.
Mental health is a very big thing that before now has not been given the attention needed. But I think increasingly we've seen that changing. As you are aware that recently the president assented to the Mental Health Act, which has been long in coming, and I think that's a game changer for the mental health landscape in the country. It just shows that the government is committed to the mental well-being of Nigerians, and a very big issue also with mental health is the issue of stigma and discrimination. And the Mental Health Act speaks to a lot of this, protect the right of people that are living with mental health disorders, and put in place conditions that bring mental health closer to the people, even at the community level.
Other stakeholders say the project is coming at the appropriate time as there has been increasing cases of mental health in Nigeria, especially in the rural communities. They also promise to lend their support to the project.
At the community level who would coordinate and support peer meetings and provide mental health first aid and counseling. Those are their roles at the community level. Also, the grandmothers and the family members will support affected persons and mobilize for.
We are being told exactly how this is going to be, the various approaches that is going to be embarked upon to be able to achieve the goal. And those processes are by developing the healthcare workers as well as carrying the community members along, and also training them to be able to carry out even first aid help to the people affected by leprosy that are also affected by that their mental health is also affected before they can now refer the patients or clients to a specialist, a psychologist or a psychiatrist, as the case may be.
This meeting is about providing mental health support for persons impacted by leprosy, neglected tropical diseases, and disabilities. We're here to support the project because we are experts in that field. We have been providing similar support in similar programs for persons who are disadvantaged and marginalized. It's very, very important we do this because there are persons who find it a little bit more difficult to get comprehensive healthcare, and comprehensive healthcare includes mental health. And so when you have a disease like leprosy, the impact is even worse
because of the stigma associated with it, the lack of access, the lack of opportunities as well. So you think of someone that has leprosy, finding it difficult to start a business, finding it difficult because of that to get source of income. So that's why it's important for us as a civil society organization um, to not just educate the individual affected, the communities as well, so that the person can have a better quality of life. So that
The Farankichi project is to be implemented in Sokoto, Kebbi, Niger, and the FCT. Emmanuel Onu, News 24.